Yesterday was a record of 110,000 people in New South Wales who got the jab, who were vaccinated, and that is a phenomenal outcome, and I encourage everybody to please come forward and get vaccinated. To date, we have 5.5 million jabs that we've given in New South Wales. 53% of our population has had at least one dose, and 28% of us are fully vaccinated. And obviously we want to see these numbers climb as quickly as possible, so thank you to everybody coming forward to getting vaccinated. In the last 24 hours, we had 119,000 people come forward to get testing. We had 681 cases of community transmission, with 59 at least infectious in the community during that time. And we extend our sympathies and condolences to the family of a man in his 80s who died at St George Hospital in the last 24 hours. He'd had one dose of the vaccine and did have underlying health conditions. In relation to the suburbs of most concern, Marylands, Guildford, Auburn, Granville, Lidcombe, Greenacre and Blacktown are the suburbs that Health wants us to call out today. In Western New South Wales, we remain concerned with the cases bubbling along, especially around Wilcannia and Dubbo, and the Deputy Premier will give an update on what is happening in the regions. Things are settling down in other parts of regional New South Wales, which is positive, but obviously our concerns remain about Western New South Wales in particular. I know these are challenging times, but I also can see the light at the end of the tunnel. These are difficult times for all of us, and the next few weeks will be hard. But know that once we hit those high vaccination rates, life will feel much better. Life will look much rosier. And I appreciate what we're going through is difficult, but every state in Australia will have to come to terms with the fact that when you get to a certain level of vaccination and start opening up, Delta will creep in. We can't pretend that we're going to be zero cases around Australia of Delta. As the Doherty report says, once you get to 80% double doses and you have to open up, everybody's going to have to learn to live with Delta. Admittedly, in New South Wales, we're learning that earlier than others. But having said that, what I'm absolutely convinced about is New South Wales can lead the way in making sure we keep people out of hospital, reducing the deaths, and making sure that we provide our citizens the opportunity to live as freely and as safely as possible.